Public Relations Director of 27th Investments. So we request I'll hand it back to Reena, and she will be calling upon the community leaders present here. We'll request Parthiban Shanmugam, General Secretary of the World Federation of Tamil Youth, to come up and say a few words what he and his organization is doing during the COVID pandemic. Thank you, Reena. Thank you, Kalan.
Thank you, Dr. Vijay. Hello, my name is Reena. Can you please tell me your full name of your organization, and what your organization's contribution towards COVID Relief India?
My name is Parthiban Shanmugam, General Secretary of the World Federation of Tamil Youth, US, and we've been very actively doing social media, promoting about what is happening in India, what is happening in the world. We want all the people to support and contribute whatever we can.
Thank you so much.
Thank you.
Can we please have the next representative, Shivji?
Thank you. Please state your name and the name of the organization you are representing, and what is the organization's contribution towards India's COVID relief?
My name is Shiv Agarwal. I am the chapter president of Ekal Vidyalaya Foundation. Ekal Vidyalaya Foundation is the grassroots organization for education and holistic development in India. We have at this time 110,000 one teacher, one room schools in India, and we have close to 50,000 volunteers all over the country who are helping for people who are infected or the people who are not infected. They are trying to help them how to take care of their villages. Also from the United States, so far, Ekal Vidyalaya Foundation have contributed over $1 million, and we are working further. And I am very sure that this is not just end of the road. Like Swami Vivekananda said, rise, awake, and stop not till the goal is reached. And our goal is to eradicate and eliminate this virus completely, not only from India, but all over the world. And we are here, for good cause. And I would like to request everybody to please approach all their congressmen, senators, leaders to contribute vaccines for India. India don't need cash. They have plenty of cash, but they need vaccine right now. That's the biggest need. And the United States of America can provide that, and we need to work for it.
Thank you. That was awesome. You knew about his contribution and you got the message loud and clear.
Can we have Subhash Razdanji on the stage, please? Okay, so Sudhakarji from API. Hello, sir. We welcome you here. Can you please tell me your full name of the organization you represent, and the organization's contribution towards COVID Relief India?
Thank you for organizing this great event. My name is Dr. Sudhakar Jamalagata. I'm a gastroenterologist and current president of American Association of Physicians of Indian Origin, representing the interest of over 100,000 doctors in the US, the second largest medical organization of American Medical Association, #1 ethnic organization in the United States. I'm sure every Indian on the globe suffering the pain of this pandemic, affecting their family, friends, or relatives anywhere. With the American Association API took the challenge after receiving this call from the Medical Consulate of Atlanta. So far, we raised about $4.5 million. They're all from the project of the doctors, hardworking doctors in the country. And we already shipped 1,000 units of concentrated oxygen, and we already going to ship over 100 ventilators and 200 high flow oxygen, which is very important for the patient with COVID. And also, I'm procuring more and more oxygen concentrations. We're ready to ship probably in a week or so. We are also doing a lot of telehealth, and we can help for the rural India and also educate physicians in India. So these are the most important things we are planning to do, and also working on send the vaccination to India, AstraZeneca vaccination, talking to the leadership in Washington. Thanks for having us.
Sure, thank you so much. Thank you so much for your contribution, and thank you so much for being here today. Subhashi, please come on the stage. Sure, definitely.
You did the 2 for 1.
So thank you both. We get 2 for 1, I think. And please state your names and the organization you are representing, and your contribution to the COVID relief for India, and also any message.
First of all, congratulations, and I applaud the services provided here by Reena Gupta and Kalai. And of course, Prabhakar, I see him. Good to have you here after a long time. So thank you for your services, for doing this. There are many times we need a leader to lead us, and they have provided the leadership. So we thank you so much for that. I have, we both wear many hats. I am involved with Gandhi Foundation, and then I'm also involved with the National Federation of Nepal. So we are coordinating many of these relief efforts through those organizations. In addition to that, I have been also on the White House briefings regarding COVID assistance to India. So we have had a few virtual Zoom meetings with the White House, and we have provided them, I think, authentic advice as to how they can help, and they've been very forthright in helping around with this current COVID. So I think suggest that keep up the good work and pray for the safety of people in India, and hopefully we shall overcome all this very soon, as Martin Luther King would say. So thank you so much.
Hi, I'm Anthony Talir, the Executive Director of the Gandhi Foundation of USA. Like Subhash said, we work very closely with many organizations, NFIA, ISA, and all that. And we are thankful for organizing this thing, and it's a great idea. And everyone here, I know that they are organizing, big contributions to help out India at this time of need. Thank you.
Thank you, sir. We appreciate your contribution. Thank you.
You're not leaving.
Can we have Sriniji on the stage, please? Hello, Sriniji. We welcome you here. Can you tell everyone your full name of your organization, and organization's contribution towards COVID relief India?
Thank you, Reena. Good morning, everyone. First of all, thank you to the organizers for doing a wonderful job putting this together. My name is Srini Gangasani. I'm a cardiologist here locally, also past president of GAPI and the director of the GAPI clinic. And I'm chairman for eGlobal Doctors, which has been doing the telehealth service to Indian patients by volunteers from OPI physicians as well as Seva volunteers. They've been working on it. Right now, it's going on right now. So a lot of people are taking help from eGlobal Doctors. By going to their website, just a link, one video link, click on it, and they can get the consultation usually in the same language of the patient. So we have a lot of about 200 volunteers working all the time, connecting them with the correct doctor and get the information. And we just started even trying to get people who don't have the smartphone with just the phone number. We're trying to connect our volunteers, call them on the phone and connect with the doctor so that at least they can get a phone consultation. As you know, most of the time these are mild disease, they just need reassurance. That's all they need. Once they get the reassurance, we can identify the people who need to be going to the hospital versus who can be treated at the home safely. That is the goal. I think just getting the reassurance helps quite a bit. If these people are isolated in their own rooms and not talking to the people, they get a lot of bad thoughts and get anxious. And that's where we can help by giving the counseling and the advice. That's what we're doing. We have 200 doctors volunteering. We can take more doctors. We also can have more medical students who can get experience by working as a volunteers. So hopefully we can reach a lot more people. We're also talking to critical care doctors so that we can teach our critical care people locally in small COVID centers, especially in rural areas where they're not going to have the experience of treating like what we have here. So we're trying to connect through our Global Doctors platform, critical care doctors from here to the COVID centers in India, especially in rural areas. Thank you.
Thank you, sir. We appreciate your contribution. Thank you. Can we have the next representative on the stage, please?
Thank you, Chancellor. So please state your full name and the organization you are associated with, and your contribution, your organization's contribution towards India's COVID crisis and any message.
Thank you, Dr. Chalum and Dina. We appreciate the efforts by Dr. Vijay from Chicago for coming to Atlanta and taking this initiative. My name is Chand. I'm the president of IACA. And IACA is celebrating its Golden Jubilee celebrations this year. And IACA is happy to work for India to make India great again. This is what all of us are working for. We're all collecting money. The Indian associations in Atlanta, including IACA, IFA, TAMA, DATA, GATES, all of us, we have come together. We are individually collecting money and going to contribute. Once we collect the money, we may share our, come together and buy equipment together, or individually they can reach. Most of our members have contributed through other organizations like SEVA, and IACA itself has collected more than $11,500, and we will be sending this money along with other organizations to contribute. Thank you.
Can we have Kamlesh on the stage, please? Hello, Kamlesh. Can you tell us your full name and the organization you are representing and organization's efforts towards COVID relief in India? Thank you.
Hello, everyone. First of all, thanks to Reena Gupta for organizing this event for the good cause. Please give her a big hand. I am Kamlesh Chugh from Greater Atlanta Punjabi Society. In this terrible time of the unexpected COVID-19 second wave attack on India, we must come together to send aid, prayers, and hope. We here are blessed. Please pray for the people of India. I'm very thankful to all the nurses and doctors who are risking their life to take care of others. God bless them. God bless you all. Thanks for coming. Jai Bharat.
Thank you, Kamlesh. Can we have Anjali Bedi on the stage, please?
Welcome. Please state your full name and the organization you are associated with, and what is the contribution of your organization towards India's goal.
Hello everyone, my name is Anjali Bedi and I'm representing mindfulness is doing a lot of good things throughout the world. We are trying to tackle the situation in a different way. We are trying to make sure that everyone is maintaining safe. Meditation is helping them to not get over anxious about the situation going all around the world. We have started a new hospital in Hyderabad, Tahana Medical Center, from where we have spent almost $1 million so far to build that hospital, and we are still shipping a lot of equipment from here in the next few days. We have a lot of capacity of our doctors, and they are also volunteering their services. So anybody who wants to go to the hospital's website, they can find doctors there, listen, and they can talk to them and get whatever answer they want for the questions. Plus, we are sending a lot of oxygen concentrators to all our mindfulness centers where anybody can go and get the oxygen free. You just have to go to the mindfulness center, which is the most close to them. And we are doing every night, 9 p.m. Meditation session around the world. And anybody who wants to join the meditation, you can stay calm, you can join them. You can again go to mindfulness and you can ask them where are the sessions being done. Otherwise, you can go to their website and you will get all the information how to do free meditation every night at 9 p.m.
Yes, rightly said, mental health is very, very important at this type of COVID crisis. You know, we have people, even physicians, doctors, they are not having mental breakdown. So thank you so much. Now we
have Sandeep Ji on the stage. Hello, thank you so much for being here. Can you please tell your full name and your organization name and organization effort towards COVID relief area? Thank you.
Hi, good morning one and all, and thank you Reena ji and her team for organizing this event. This is Sandeep Reddy Gundla from Greater Atlanta Telangana Society, presently serving as a cultural associate. Now, I would like to request our chairman, Chitari Papagaru, to kind of briefly speak about our organization and the activities back home in India.
Thank you, Sandeep. Thank you, Reena ji. Thank you, everybody. And good morning, everyone. Thanks for putting together this event. And I am really excited to see many people. And also, this event helped to motivate a lot of organizations to help in India. So we all know that India, there are pandemic going on, situation not good. And definitely we all need to help. So my name is Chitari Poppa. I am current Greater Atlanta Telangana Society AX board chairman. When we hear about COVID situation in India, we started talking with the local Telangana government and administrative IAS officer and coordinating a lot of activities to help in Telangana state. So primarily we partnered with IFA and sending oxygen concentrator to small towns in Telangana, especially primary healthcare centers and talukas and district headquarters, so that immediately if any life-threatening or have a people, so that oxygen concentrators are very much helping. And also we distributed medical PPE kits, especially rural Telangana area, and providing financial help on case-to-case basis. If any needy people, they want to need help to pay the hospital bill, or they need a bed in the government hospital or anything, we are coming forward and helping. And same time, we are also working with local volunteer group to conduct food and grocery supply. So we will continue to do this same program next 1-2 months. And also same time, we are appreciating all frontline workers, doctors in India, especially in Telangana rural area. And also, we created one local health group with a group of doctors and virtual consultation. And if anybody need virtual consultation, we are helping. We are also helping the senior citizens who they don't have any kids living with them. So especially NRIs who living in Atlanta, we are helping. We identify the agency to help them in all cities. And also we are also helping the knowledge sharing to COVID health group. And thank you very much. We will keep continue to do COVID help in Telangana state from Greater Atlanta, Telangana Society. Thank you very much, and thank you all.
Thank you so much. Can we have Dr. Satyavedi on the stage, please? Hello. Hello. Thank you so much for being here. Can you please tell us your full name, your organization name, and the efforts from your organization towards COVID?
Hello everyone, good morning. My name is Satyanarayan Reddy. I represent the Greater Atlanta Telugu Association. And we have been doing a charity for the last 20 years. And last year we did, when we had the first wave, we did the help locally. And now we'll be doing for India too. And we collected a lot of money from our donors. That includes Reenaji from Seven Investments. And we are so thankful to all the donors that are helping to this need of the hour in India. And we will be helping particularly in Telangana as well as in Andhra Pradesh. We are going to supply the medical supplies to both the states, Telugu states, and that's what the Telugu community of Atlanta requested us. And based on that, our donor base we are doing this. And when I see a lot of organizations raising money and sending money and oxygen concentrators to India, it's overwhelming and it's really good, and God bless all of us and God bless India and Indian population. Thank you so much.
This is Sai Gurapati, representing Atlanta. Thank you very much for
Thank you so much for being here. Can we have Dr. Gulshan on the stage, please?
But for the audience, please state your full name, the organization you're associated with, and of course, we all know all the efforts you take to take care of India's COVID crisis. Please tell your contribution and also a message.
Thank you. Thank you very much to both of you and all the other organizers for putting this critical event together. I'm Gulshan Harji, and I've been in Atlanta for 4 decades now. I know I don't look like I have been here 14 years, but I am. I represent UNICEF, which is a household name. UNICEF has been in the global humanitarian work for 7 decades. And in India, it has been present since 1949. So UNICEF is very aware and has the pulse of India and has the pulse of the people of India. And UNICEF stands in solidarity with the country of India. We are completely aware that India represents 20% of the global population, and we must not turn a blind eye to India. So I encourage everyone who is here to contribute generously to the COVID crisis in India. But I will quickly wrap it up for UNICEF in that its global pledge is at 200 million right now. As far as India, the pledge right now is around 20 million. Right now, UNICEF pledges to provide 20 of the oxygen generators to hospitals on site so that the oxygen is available to the patients right there at the hospital. In addition, and those come at 180,000 apiece. Additionally, UNICEF pledges to provide approximately 200 RT-PCR machines right on site for several locations in India. And those come at around a cost of 25,000 each. But additionally, as you're aware, UNICEF has provided the maximum numbers of vaccination, more than any humanitarian organization, and it continues to venture into providing COVID vaccinations for everybody in India. Through its leveraging power, UNICEF can procure a vaccine for $3.50. So besides procuring vaccines, it is continuing to partner with other organizations in providing cold chain training for volunteers and healthcare workers on the ground, as well as providing supplies to get the vaccines into the arms of the Indian citizens. So I stand here in solidarity of India and on behalf of UNICEF, which is a branch of the United Nations. Thank you very much.
Can we have the next representative on the stage, please? Venkat. Hello, thank you so much for being here. Can you please tell us your full name, your organization name, and your organization's effort towards COVID relief in India?
Yeah, thank you, Reena ji and and Producer Investment Group for organizing this event. I am Venkat Gagan, I am Executive Director for Telangana American Telugu Association. And thank you all for coming over here. And I should say it is a tremendous effort for all the organizations. And everybody, all the organizations took a great initiative and try to help India in all possible ways. So I appreciate all that. Coming back to our organization, we have a task force created from Telangana American Telugu Association, which is working 24/7. Most of them are from America and some in India, coordinating in WhatsApp and other social media. So the main targeted area from our organization is who are in need, they call for any injections which are in a demand. We are providing injections everywhere, and any medical help or medical kit, anytime they need, we have some kits. And our volunteers in India who are going there and handing over the medical kits in emergency cases. And at the same time, we had a unique program initiated by Telangana American Telugu Association. Basically, in all cities, we have a scope through social media. We can canvas and say the COVID situation and the precautions and vaccination. But going back to the remote and villages and districts, what we did is the old method. We went to an audio system, and all villages, like 300 villages in the district, going around and getting the awareness to the remote people about the vaccination importance. At the same time, the precautions to be taken during COVID, and at the same time, not to be worried and not to be panicked. Be strong, and that is the main factor which will get the country and everybody out of this pandemic situation. And I think it's a great opportunity, and I would like to thank our TPA president and our founder Mallareddy Garu for our establishing the organization. Thank you all.
Thank you so much. We appreciate your presence. Can we have the next representative, please?
Welcome, both of you. And please state your full names and the organization you are associated with. And of course, your organization's contribution towards India's COVID relief efforts.
Hello everyone, greetings to all. Hello everyone. Greetings to all. I am Kamal Satuluru, Chairman of TAMA Board 2021. And with me, Saira is the Secretary of Executive Committee, TAMA. Just want to say a few words about our organization and what we are doing. Really, it's a commendable effort that many organizations of Indian and non-Indian origin coming together to show solidarity to support what the world and especially India needs today. TAMA is also a sincere partner in this effort. I want to give a quick update of efforts from TAMA thus far. Since pandemic started last year, TAMA Free Clinic has supported needs of people through teleconsultation and prescriptions to especially visitors who stuck here for longer than planned. 2 weeks ago, TAMA successfully conducted a vaccination boot camp here in Atlanta, collaborating with TAMA and Kettle Pharmacy, and a follow-up session is scheduled next week. To support needs of India with second wave of COVID-19 devastation, we have raised around $20,000 so far, and our efforts are continuing. We also intend to use this money for supply of oxygen concentrators and other medical equipment, and providing any support, psychological support to Indian origin people. We are collaborating with other organizations like in working out the logistics to distribute and expand our health to Indian origin. I encourage and thank everyone to keep the momentum going to help in our COVID-19. Thank you.
Very good morning. This is Sairam Dharmanji from Telugu Association of Metro Atlanta. Thank you everyone for coming forward, and pronouns to Reverend Jesse Jackson-ji, Reena-ji, and all the leaders, Atlanta leaders. It's very good to see everybody together. And US and India are like two eyes for us, definitely. And right now, our country needs something from us. Definitely, we are doing that from TAMA, and we are all doing that. Jai Hind, God bless everyone. Thank you.
Thank you so much. Can we have the next representative, please? Hello, Gautamji. So good to see you here. Can you please tell us your full name, your organization name, and organization efforts towards COVID relief in India?
Thank you, Reena-ji.
Thank you, Reena-ji. This is Gautam Kohli, and along with me, I have Nayan Joshi-ji. We are representing ITServe Alliance and our sister company, ITServe Corporate Social Responsibility. So, with this organization this year, the moment we got to know that there is second wave coming up in India, within 4 days, our organization was able to raise funds over 200,000 within 4 days, and then immediately we coordinated with Seva International, UPS, and API, and we were able to do the consignment oxygen concentrators shipped to India. And the proud moments are, we see that they are utilized in various cities across India at COVID relief centers, including Vizag, Delhi. We have all the pictures of those things. That really make all our members and all our leadership proud, and we are so happy to be part of all to this greater cause that Seva is doing, and API is doing, and all our Red Cross is doing. So we will continue to be part of it, and any organization needs anything, we are here to support, and we are open to work with every organization. And likewise, we have also contributed oxygen concentrators. With the help of Red Cross, we sent it to India, and they are put to use today. And within a short span, the credit goes to our organization by raising over $500,000 funds and put them to the best use that for the COVID relief in India across. So we truly thank all our members, all our leadership, especially our IT Serve Alliance President Raghu Chichimalla, and all the office bearers, office directors, and executive board for doing this COVID relief. And also as part of the initial COVID that happened here in the US, we have again partnered with Seva International, and we did at Radial Springs Church in Albany, Georgia, and we were part of supporting the families for their immediate processes and reliefs and things like that. So we take this opportunity in this platform. Thank you, Reena Ji, 27th Investments, and we are looking forward to having Reverend Jackson here today shortly, and then also all the media partners here. And united we stand. This really proves that all our organizations coming here, and Reena Ji for putting this effort of bringing all the organizations together. These are proud moments for every Indian to celebrate. Let's continue to stand united. Thank you. Jai Hind.
Thank you, Gautam ji, so much for being here. Can we have Chatur ji on the stage, please?
Good afternoon, everybody.
Welcome. Please, it's already started, but yes, go ahead and introduce yourself, your organizations, and all the efforts.
Good afternoon, everybody. My name is Chatur Chavaria. I'm President Rotary Club of Ambedkar Hill. Most of you know the Rotary International is very, very active for any disaster and disease education, and Rotary Ambedkar Hill is one of the part of that. We doing all the work from clean water to the hospital setups and things like that. And good to know all these organizations are getting together here, like Rotary has a motto, service above self, and this is all the organizations doing that. Thank you for that. We are in COVID relief. We are working together with Rotary International and other organizations like Saurashtra Samaj, Kadwa Patidar Samaj, Joy of Share Foundation, and Pura International here in the Swan Mountain. So, and we have secured almost 2,000 concentrators, and it's being shipped to the remote parts of India, like Amreli district. I got the email that they received 15 concentration and more are on the way. And Rotary others doing is providing the food, and on hand the goods, they are providing oxygen cylinders and things. I did talk to Rotary International COVID Action Coordinator Kamal Sangvi in India, and they have already set up 2 hospitals, one in Delhi and one in Udaipur for the COVID relief. 3 oxygen plant, emergency plant they set up. So Rotary is in all action for the COVID, and thank you very much, everybody. It's good to see everybody in one platform. Thanks.
Thank you so much. Can we have Dr. Chandra on the stage, please? Thank you, ma'am. Thank you so much seeing you here. Can you please tell us your full name, your organization name, and organization efforts towards COVID relief in India?
Being a psychiatrist practicing in Canada for the past 40 years, I'm representing Association of Kerala Medical Graduates. Since the onset of the pandemic, India has lost thousands of healthcare workers
including many eminent physicians, nurses, and other healthcare workers. AKMG, after much assessment of the current situation, decided our focus need to be taking care of the health givers. So we have been raising funds. We have been raising funds towards this end. Our goal is to raise up to $200,000, and we are very close to that. We have allocated about 2,000 of pulse oximeters to India last week, and our next trip is going of PPEs leaving next week. Ever since the onset of the pandemic, we have done many educational activities to help the local community here as well as the Indian community. We have conducted many webinars, educating the people the need for vaccination, educating about the illness, treatment and prevention. We have conducted webinars between the experts in this country as well as in India to exchange ideas. We are in the process of, we are afraid because of this pandemic, the funds will be running out. So please help in our efforts to help the caregivers. Thank you. And thank you, organizing this.
Thank you so much. Can we have the next representative, please? Hello, thank you so much for being here. Can you tell us your full name, your organization name, and your organization efforts towards COVID relief in India? Thank you.
So, thank you, Reena ji, for bringing us all together in this platform. My name is Vitik Shah. I am from Bengali Association of Greater Atlanta. I have Kishore Chakraborty. I am the current president, he is the ex-president. So, from Bengali Association of Greater Atlanta, we have been working on the COVID relief from last year itself. We also donated funds for Amphan, which devastated Bengal and within the eastern region. So this year, before even the first pictures came through, we realized that the situation in India is real. We started collecting funds. We focused on the oxygen concentrator at first. Right now, we are working on 3 or 4 projects, specifically donating equipments to various hospitals in West Bengal. We are also working to set up a hospital facility in Sundarganj, which is a remote place in West Bengal, and also directly working with the West Bengal Health Secretary to figure out what kind of equipment from here we can send to them. As we do that, our next focus is to ensure that maximum people get vaccinated. We want to see whether we can donate funds towards that, as well as ensure that the communication goes through that vaccination is critical for the communication of this illness. Thank you.
Thank you so much for being here today. Can we have the next representative, please?
Hello, this is Kiran Manchakanti. I'm representing the UPS, United Parcel Service. Since the pandemic started in India, UPS is committed to support in terms of transport or logistics support. Being in India and working for UPS for the last 20 years, I'm very proud of how UPS has reacted and the support we are getting from the executive leadership. So get well India soon. I wish you good luck and we're all with you. Thank you.
Thank you so much for being here and your contribution towards COVID relief. Thank you.
I would like to call the next spokesperson, please.
Hello everyone, my name is Kiran Pashu. I'm representing American Telugu Association. Since the COVID has started, ATA, which we call ATA, has been to the scene doing a lot of activities. Especially in the recent, we did send 100 oxygen concentration to Seva and collaborated with Seva and Kali. Also, we also have a task force within the ATA that is taking care of all the needs work which has back both in the states. And in few cases we have reached out of the states also. Again, we are all in this together, and whatever it takes, we will support from here. And thank you, Raji, and everyone who is organizing.
Thank you, Kiranji. It's so good to see you here. Can we have the next representative, please?
Hi, thank you for coming here. Please introduce yourself and your organization. And also, we would like to share how the organization is helping in this situation.
Thank you, everyone. I'm Swaminathan. I'm representing Greater. We had the first wave, everything was fine. Second wave started. It's good to see all of the Indian diaspora getting together and supporting, and we are doing our part as well. We are collaborating with Seva and a few other organizations, and we have the rapid response task force helping the doctors and with the local agencies on the oxygen level, the concentrators and back in London. And we have I think medical director. She's doing the doctor support and everything. So we have a good team, and we're doing our part. And thank you everyone for your organization.
Thank you. We appreciate you. Thank you. Can we have the next representative, please?
Thank you for coming, and we understand that in this pandemic situation, we all are coming together and helping us together. So please introduce yourself, and we would like to hear from you.
Hello everyone, my name is Sunil Mathur and I am president of Rajasthan Association. Our association is a very small association, but looking towards the size of association, we are doing pretty good. And I will request all big associations to please help us. Already we have sent a lot of medical equipment to Rajasthan, and now we are focusing on the after effects of this pandemic. Now I explain Mr. Robert will.
On behalf of the local Sikh community in Atlanta, I want to let you know that the entire Gurdwaras, temples in New Delhi have been converted into COVID camps. Most of these Gurdwaras are providing free dinner, lunch, and oxygen concentrators. Most of these Gurdwaras are open for any suggestions, and most of these Gurdwaras are being supported from the US, Canada, and the US area. Khalsa Aid and the Sikh Gurdwara Prabandhan Committee, headed by Manjinder Singh Sirsa, has converted Gurdwara Rakhabganj into entire COVID hospital. This is the first time in the history of India that the entire big Gurdwara has started a COVID hospital within the temple complex for 400 active patients as well as continuing services. We need your blessings. One thing you need to remember, we are all in this together. Separate organizations are a great idea, but the help rendered at a macro level is the help that we need right now. We should get above all of these organizational levels and help one another as much as we can. Thank you so much.
I think everyone spoke. So now when everyone has spoken their mind about COVID relief, I once again want to thank you, every organization head and everyone who helped putting this event together. Thank you so much.
Friends, we have with us the Reverend Jesse Jackson in person here today. We will start the press conference exactly at 12:30 p.m. I will request the speakers to come and join Reverend Jesse Jackson on the stage, and I'll have Reena ji and Kalai select the next row of community leaders to stand behind, and we'll start exactly at 12:30. The mainstream media, Fox TV is on its way, we are told, and the other channels, so 12:30 will be on time. Thank you all for coming. Pray for India, and we're going to start in a few minutes. Who's doing the YouTube? Who's the YouTube guy? What's his name? So you're doing the YouTube, but you take pictures of all the people. Please ask them to be seated.
Only one representative from every organization to come on the stage, please.
The speakers will be out here.
Dr. Srini Gangasani. Please come here. Okay, so, yeah. Can we have Dr. Gulshan on the stage, please? Dr. Andrea Giulio. Dr. K.N. Venkat Narayan. He's not here yet? Okay. Dr. Lizzie Thalia. Okay, she's here. Mr. Swadesh Patoch. He's right there too. Mr. and Mrs. Divesh Ranjan. Are they here?
He's here.
Okay. All right, sure. Mr. Kiran Manchikanti. Okay, we got him. And Mr. Shiva Garwa. Okay, he's here. So we got all our speakers. Can we please have our chief guest, Mr. Reverend Jesse Jackson, on the stage, please? And a big hand for him. Can we also please have Mayor of Norcross on the stage, please?
You all can come closer and get in the position. I will make sure that you come here. Also, so make sure all your face frames are there. And just wait for some time. Sudhakar ji, our RP president, said he allows us to take the mask off for a second for a group photograph before we start. So you can take your masks off. That's what our RP president chief has ordered us. So we are mandated by. So don't worry for a quick second. If anybody else wants to join, please join in for the picture. Friends, we have with us Mr. Craig Newton, the mayor of North Cross, the suburb which we are all assembled. He's the first mayor of color and been 2 terms in the whole Gwinnett County. And he would like to welcome the Reverend Jesse Jackson, the founder president of the Rainbow Push Coalition, the US civil rights leader who led the march with Martin Luther King. And he has flown into Atlanta to be with all of you, making sure Atlanta has been the hub of India COVID relief from USA. So he wants to say thank you and how he can nurture this movement to the next level. Please welcome the mayor of North Cross, Mr. Craig Newton.
Good afternoon, everyone. I think it's good afternoon. First of all, let me just say welcome to the city of North Cross as mayor. I am Mayor Craig Newton. And I want to thank everyone for being here today in complete solidarity in support of our Indian community. As you all know, over 20 million deaths have occurred in India concerning this COVID-19 virus. And I just learned today, I got a report from New Delhi that 125 people will die every hour unless we do something. We must do something. And I'd just like to welcome also our civil rights advocate, and he's been on the battlefield for a long time. Reverend Jackson, and I met him about 20 years ago when he came doing some work here in the city of North Cross, so he's not a stranger to us. 4 years ago, I welcomed the late Congressman John Lewis here to the city of North Cross, and the long fight for equity, civil rights, justice, and for the health and safety of all. So I want to thank you all for being here today. And I want to especially thank Reverend Jackson for this initiative to help our people in India. North Cross is one of the most diverse cities in Gwinnett County, and we're proud to be partners with our Indian community in helping to alleviate this terrible virus that we're dealing with right now. We're only as strong as our weakest link. Thank you all.
Thank you, Mayor, for that wonderful word of introduction and welcome. We all feel so at home here, like our good friend Swaminathan from the Atlanta Tamil Sangam welcomed us earlier. We want to say a big thank you to all of you. We heard your incredible stories a little while ago, how the different organizations have done it, how the Gurgawas across the country have opened up and become COVID hospitals today. And as the gentleman from the Atlanta Punjab Association said, that we all are one at this time. And I would like to tell you that we are meeting the press conference, which is being hosted by the Reverend Jesse Jackson, will meet, and the host would be Dr. Kalaiselvam Parthiban, who you all know is the Georgia chapter president of American Association of Multi-Ethnic Physicians. Dr. Kalaiselvam is also part of API, which is headed by Dr. Sudhakar Jandarala, and she's also the past president of the ATMA, American Tamil Medical Graduates Association, and she's also part of the Atlanta Tamil Sangam, and she's a vibrant community figure who gets her inspiration from none other than Reena Gupta, who you all know, who's from the 27th Investment. And we'd like to acknowledge Mr. Mustafa Ajmeri, who's not with us, who's the man in Atlanta who put all this together and brought all of you all together. We'd also thank Shiva Agarwalji for hosting us. And without much ado, I'll turn the mic over to Dr. Kalaiselvam Parthiban. Dr. Kalai Parthiban.
Good afternoon, everybody. As Dr. Vijay said, I am Dr. Kalaiselvam Parthiban. I am the Georgia State Chapter President of American Association of Multi-Ethnic Physicians. The Reverend Jesse Jackson, who needs no introduction, he's the founder and president of Rainbow Push Coalition and recipient of the 2000 Presidential Medal of Freedom, the nation's highest civilian honor. Sir, we are thankful to you for calling all of us together to help India come back from this COVID pandemic crisis, which is creating major havoc back home. I would also like to invite Mayor of Norcross, who is the first mayor of color to this event. Thank you. First of all, I would like to welcome you all for this press conference in Atlanta, Georgia, and be part of Reverend Jesse Jackson's initiative to help India's COVID relief efforts. Globally, as of 6:18 p.m. CEST, May 14, 2021, there have been 160,813,869 confirmed cases of COVID-19. It is a sad occasion, sad time. We have 3,339,002 deaths as of May 14. India has accounted for nearly 50% of the world's new COVID cases, as well as 30 of global deaths. With the emergence of a new variant and the second wave, the nation is struggling to breathe. As there is a huge shortage of oxygen, hospital beds, ventilators, medications, healthcare staff, including doctors, and we can keep on saying. Reverend Jesse Jackson had earlier urged the current US administration to send the unused 60 million doses of AstraZeneca vaccine to India, which is stockpiled in Baltimore. We, as Indian American physicians, multi-ethnic medical community, non-profit organizations, businesses, community leaders, and individuals have gathered here today to support recovery of India's unprecedented COVID-19 crisis. Now, I would like Dr. Vijay Prabhakar, the National President, American Association of Multi-Ethnic Physicians, to give us the opening remarks. Dr. Vijay Prabhakar, a public health professional par excellence, is our community leader and an ardent supporter of Indian COVID relief efforts throughout the country. Dr. Prabhakar is the founder chair of US Congressional Multi-Ethnic Advisory Task Force and holds several distinguished positions. Dr. Prabhakar's proven leadership, you've already seen that here. Excellent organizational skills, dedicated motivational efforts, creative and innovative approaches to various community issues resulted in his appointment as Vice Chancellor of Fremont University in January 2020. Dr. Prabhakar, please give us the opening remarks.
I join you all today with a heavy heart. Dr. Kalai Chelvam, as I already told you, the President has done a wonderful job in organizing not only the COVID relief efforts to India, but also putting this event together to showcase all your efforts in helping India during this most unprecedented humanitarian crisis. I would like to salute our renowned civil rights leader. It was his initiative. We can't take any credit that he wanted to host this press meet and ask you all what he can do more for India. He did a similar event in Chicago and had a great response, which enabled President Biden to also remove the immunity from the intellectual property rights. And he was so moved by what's going on in India that he took up the phone to talk to President Biden, as Dr. Parthiban said, about the unused vaccines stockpiled in Baltimore, to release it immediately to India. What we need today, Reverend Jackson, is the Biden administration has to act immediately to supply India with the unused COVID vaccines, to flatten coronavirus pandemic in India. Some of the state governments in India, as you know, are able and willing to purchase over 1 million doses of remdesivir, the antiviral medication. And also, we are requesting you, Reverend Jackson, to speak to the pharma giants and the US Congress to urgently respond to these needs of India. The state governments are also willing to purchase the vaccines from Pfizer, Johnson & Johnson, and Moderna, and requesting you, sir, to use your efforts to unite from the highest level to ensure that immediate aid is given to India, cutting across all barriers in with the US administration. President Biden's administration doing a great job, but we want them to do much more because the gap is so wide. And we are requesting you, Reverend Jackson, to use your efforts. Reverend Jackson, as you know, is going next week to Washington, DC, and he's going to be there from May 18. And he's going to lobby for our efforts to make sure that any barriers which are there would be broken down so that aid to India is rushed immediately. And that's what we need today, sir. We're calling on all the hospitals and healthcare institutions across the country to please donate in-kind equipments like oxygen concentrators, ventilators, and other much-needed PPE supplies to India. And we have organizations like the FIA Chicago is willing to do the shipping costs for those to help out the hospitals and rush the supplies to India. I know that Seva International USA, the Vishwa Hindu Parishad, and RP, and all the other organizations are doing an incredible job, and weekly shipments are going. But it's not yet enough. We need to do more. And Reverend Jackson, you have to lead this charge from US to India. Thank you.
We have a room full of passionate people. On the stage, we have a few compassionate leaders who are going to be our speakers today for this event. Our first speaker is Dr. Sudhakar Vanillavada. He is the current president of the American Association of Physicians of Indian Origin, API, AAPI, USA. He is a gastroenterologist and has been in practice in our hometown of Georgia. So Dr. Sudhakar, I invite you to give us the presentation.
Thank you. Thank you very much. Thank you, Reverend Jesse Jackson, for joining us today. Indeed, you need your help. Thank you very much. Thank you. API, American Association of Indian Origin, represents interest of 100,000 doctors, supporting the leading cause of motherland. We raise about $400 million. That's not enough. What we need is the largest two democratic countries in the world should have. This is the first time we are begging, actually, from the US point of view, to help India because of leading cause. We need vaccination. We need medication. We need to restrict what we call it, most importantly, send the raw material for vaccination, medications, steroids, and protection. They are very important right now, current crisis. Take it, state of Goa. There are 60 people died in one day because of lack of vaccination. This is very important for us. Your Raipur push will help this. You need to push the capital, President Biden, Kamala Harris, tell them to send the vaccination raw material to them. Thank you again.
Thank you, Dr. Sudhakar, for that wonderful, heartfelt plea. And Reverend Jesse Jackson is going to take our plea and our request to Washington, and we will beat the COVID crisis. Now, the second speaker is myself. I represent various voluntary organizations in the US and also at the international level. American Tamil Medical Association, ATMA, ATMA, leading sword in Tamil language, is a US-based non-profit organization, and I currently serve as its chairwoman. Since its inception, Atma has been doing multiple, innumerable health-related charity works in and around the US and as well as on the international level. Ever since the coronavirus reared its ugly head in the United States of America, Atma rose to the occasion. A COVID-19 common task team was born, rendering knowledge exchange, webinars, prescription assistance, monetary help, immigration assistance, and so on and so forth. With India now being the epicenter of COVID-19, the team extended its arm to deliver assistance to a brother back in India. On May 2021, Mother's Day, Atma joined hands with many local command organizations in a fundraising effort, raising $2 million within a span of a couple of days. This fund will be utilized for the current urgent needs in Tamil Nadu, channeled through the Tamil Nadu Foundation to the Tamil Nadu Medical Council. We are collaborating with physician bodies here in the US as well as in India in establishing protocols, guidelines, and telehealth services. Partnering with other medical associations in the US and India, teleconsultation services are being rendered. As medical director of one of the Georgia Department of Public Health, GATS Medical Clinics, Atlanta, Greater Atlanta, Thomas Sangam as well, we are doing telehealth services. We are reaching out to the Health Secretary, Department of Health and Family Welfare, offering our support to our fellow physicians who are stretched way too thin and burned out due to increasing patient load. I urge Reverend Jesse Jackson, I urge all Indian American physicians to renew their medical license in India. So with Indian medical licensing board having relaxed some of the policies, so we can uplift the extremely exhausted healthcare system in India. Thank you. Now, going to the third speaker, I welcome Dr. Srini Gandasamy, Chairman, eGlobal Doctors, past President of GAPI, and Director of GAPI Clinics to give his presentation.
Hello everyone. Thank you for doing all this. I think I really appreciate organizing committee to making this effort to get India help in this time of crisis. So as a eGlobal Doctors, which is a telehealth platform started by Indian physicians and IT professionals to connect doctors as well as the patients from anywhere in the world at any given time along with their families on the same platform. So when this happened a few weeks ago, we changed our gear. We tried to help our Indian COVID-19 patients by providing consultations and advice in the form of physician volunteers by WAPI as well as the SEWA, who have done a wonderful job providing these consultations. This is a big round of applause to SEWA and WAPI and the good job they are doing in this effort. We're glad to be partnering with the WAPI as well as SEWA, the doctors of SEWA in this effort to provide the telehealth consultations to patients in India. It's an easy one click. You go to the eGlobalDoctors.com, click on the video link, patient can be joined by a volunteer who will take you to the room, the Zoom, and then the doctor will come and join them. Most of the time, we'll make an effort to join the doctor in the same language, speaking the patient the same language, so that they can be just easy to do the job. The goal for these kind of initiatives are, one, to decrease the burden on our Indian physician population there who are working hard over the last few months. The second goal is to identify who have mild disease versus severe disease. Most of the time, people with a mild disease, they just need a little reassurance to alleviate their anxiety so that they can be treated at home. Most of the time, they're in the room, isolated, they get a lot of anxiety. So by identifying who can be treated at home versus being sent into the hospital, we can decrease the clogging up of the emergency rooms and the hospitals, and the resources we can use more wisely. Thirdly, we're also working with the Indian government as well as from the SEWA and WAPI point of view, trying to put together a critical care doctors team to help our critical care people in COVID centers in rural areas of India where the senior physicians are not available. So hopefully that will make our critical care physicians help the patients, sick patients in the local rural areas to help the patients. And also through the e-global doctors, we're trying to connect by phone who do not have the smartphones, who cannot come to the website. So please help in this global platform called e-global doctors. Please, you're a doctor, volunteer, join, and help us register at the site so that we can provide more services to the more people. So be safe, be healthy. Thank you.
Introducing our next speaker, Dr. Andrea Julio, President, DeKalb Medical Society. She also serves as the Company Director for the Board of Medical Association of Georgia, MAG. She has been practicing family medicine in Tucker, Georgia for the past 20 years. Dr. Andrea Julio.
Thank you for having me, inviting me to this, and Reverend Justin, it's an honor to have you here supporting these efforts. My speech will be very short. The current humanitarian crisis in India, the second COVID-19 surge, consumed a humanitarian catastrophe. The United States and India have long been strategic partners, especially in this globally connected world. The COVID-19 crisis is not only India's problem, it's the world's problem. We need to be integrally involved in removing bottlenecks to deliver much needed supplies, medication, PPE, oxygen, the telemedicine services were just discussed, physicians who are willing to help. We know that, as mentioned before, there is a very large vaccine supply at AstraZeneca, and we need to demand that vaccine supply be released. Even for the smaller countries that suffer, we need to share these formulas for vaccine production so that everyone has a fighting chance to get systemic and vaccinate the populations. It's imperative that we act now. It's in our own self-interest to be engaged with our Indian brothers and sisters. Our actions now will be remembered by India's people for generations. Thank you.
Our next speaker, Dr. K.M. Venkatarayan.
Ready to go. He's ready to go.
So he's not here. So moving to the next speaker, Dr. Lizzie Talayer, Physician Executive, Association of Kerala Medical Graduates, USA. She is a psychiatrist, has been practicing in Georgia over 40 years. Dr. Lizzie Talayer.
Reverend Jackson, dear friends, our hearts are broken by the calamities of ravaging COVID in India. I'm representing the Association of Kerala Medical Graduates. Since the inception of the pandemic, we have been collecting funds to raising the funds to help the COVID situation in India. AKMG leadership has done extensive assessment of the situation and have arrived at a conclusion that supplying adequate high quality protective equipment is the need of the hour. The decision we made has been debated because of the number of healthcare workers lost due to this pandemic. We have seen the severe shortage of doctors here and in India. In order to protect the healthcare workers, including physicians, nurses, and other workers, we need to protect them. The AKMG is supplying PPEs and oximeters. We have shipped the first shipment has gone to India last week, and the next shipment of the PPE will be going next week. We have conducted many webinars between the two countries to educate the patients as well as the physicians. Our concentration now is to help the medical colleges in India
and also the district hospitals. So we will be sending our supplies to these facilities. Thank you for all the help, and we request help from everybody in our effort to collect funds. Dr. Jackson, any help you can give us in obtaining the vaccine will be great to save the lives of the many in India. Thank you.
Dr. Gulshan Haji, a global physician. Gulshan serves on the Southeast chapter of the UNICEF Board, a humanitarian organization well respected and recognized for its humanitarian work. Dr. Haji.
Reverend Jesse Jackson, first of all, I'm awestruck and I am moved to be in the same room with you. I express my deep gratitude that I'm a naturalized citizen today. I arrived here 4 decades ago, only 6 months to becoming stateless. I express my gratitude to this great country for allowing me to become a US citizen. I am a global citizen, have lived over 4 continents. I came from a village of 500 people, a recipient of UNICEF's vaccine program. And I've come a full circle today, serving on the board of US Fund for UNICEF. As you know, UNICEF is a branch of the United Nations. It has been around for 7 decades and has been in India since 1949. UNICEF has the pulse of the country of India and the pulse of the people of India. India represents 20% of the global population, and we must not turn a blind eye to India. India's problems are the problems of the world, and whatever it is that we do to rescue India will trickle down to us in many forms. Today, India is struck by one of the worst crises, worst humanitarian crises, the COVID crisis. It is currently experiencing a very contagious, very infectious variant, and it is only going to require our effort to reach out to India. UNICEF, since I spoke 30 minutes ago, UNICEF's pledge has gone up from 200 million to 660 million. Reverend Jesse Jackson, I will not probe into the details of what UNICEF is doing in India in terms of oxygen generators on site at 50 hospitals. UNICEF is also pledged to provide 220 machines that will provide rapid testing, PCR testing on site. But UNICEF's main signature is vaccines. And UNICEF's leveraging power is that it will provide vaccines and procure vaccines at $3.50 a piece. UNICEF continues to partner aggressively so that it can provide cold chain support, supporting workers, volunteers on the ground in India. So my pledge on behalf of UNICEF is that we are standing in solidarity with the state of India. We will not cease. We will work relentlessly and tirelessly to provide the necessary funding for India. And Reverend Jesse Jackson, I again express my deep gratitude for all your efforts that you have done from the very beginning to bring this nation and to bring us where we are today. My gratitude. Thank you.
Mr. Swati Katur, Vice President, Disaster Recovery, Seva International, USA.
Namaste everyone. It's a pleasure to be here with you, sir. From Seva International, we have partnered with many organizations, and so far we have procured around 11,000 plus concentrators worth $10 million+. And right now, these concentrators, around 2,000 plus, has been already being distributed in 24 states in all over India. around 2,000 plus has been already shipped from here. 2,000 plus are lying in our warehouse in Atlanta, and 4,000 plus we have already placed order for. So that's our concentrator. We have already purchased 200 plus ventilators, and right now the situation is evolving every day. I will just give you one example. Like 3 days back, there was a news that 18 professors died at Aligarh Muslim University, and today our team distributed them concentrators. That's how we are working. It's really a pleasure to work with so many different organizations, including API, ITServe, and many other organizations here. So thank you so much.
We have the co-inventors of low-budget ventilators, Mr. and Mrs. Devesh Ranjan.
Good afternoon, everyone. First, I'd like to thank the organizer for calling me here. So I'm Devesh Ranjan. I'll say more than co-inventor. I'm right now the interim vice president for interdisciplinary research at Georgia Tech. And I'm here because I really feel this is a cause which is hurting a lot of students on campus, which I can see. My wife is not here because we lost her grandma earlier this week. So this is happening and affecting everyone in the family also. But I'll say one thing. I heard about UNICEF's promise in this case that we're going to move things. This is a human rights crisis. This is not just a humanitarian crisis. The human rights crisis, the right to live, right to health care is for everyone. And it should not be just for people which have the technology they can afford. Technology needs to work for everyone. And we need to have frugal innovations which bring social equality for everyone. So I urge everyone to open the IP. And on that regard, Georgia Tech has already decided the IPs in ventilators and in terms of surveillance testing for COVID is open. If anyone wants to take it and build it in India, we will bring it to them. So that's my request. If everyone wants to.
Mr. Kiran Manchikanti, Vice President, Information Technology, UPS, Atlanta.
Good afternoon, everyone. Thank you, Reverend Jeffrey Jackson, for your support towards India Relief. Since the pandemic has erupted, UPS leadership has been an overwhelming support, and we have taken over initiatives towards logistics support, transportation, and being at 20 years, I've been working with UPS, and it's been a proud moment for me, unfortunately, because being a global company is not just having operations globally, but having the people with the global heart and the executive support that we get when this kind of situation. And it's a special moment for me, being representing UPS here. Thank you very much.
Mr. Shiv Agarwal, President, Ekal Vidyalaya Foundation, Atlanta chapter.
Thank you. Reverend, welcome to Global Mall, welcome to Atlanta. I'm Jeffrey President of Ekal Vidyalaya Foundation. Besides contributing $1 million in cash contribution, the best thing is that the Ekal Vidyalaya Foundation in India is providing over 50,000 volunteers to help the villages, help the people who need the help, physical help, and also besides that, 110,000, one teacher, one homeschool. All the teachers are involved to taking care of the holistic development of the villages. And I would like to quote one thing over here, like Swami Vivekananda said, "Arise, awake, and stop not till the goal is reached." And the goal is far away right now. We have to keep working. And as Dr. Vijay said, that we need to request the US government and all our congressmen, senators, and see if they can come forward. And this is a humanitarian crisis. It's a tsunami of this COVID virus. We must do our job. And this time, beside the money, we need the vaccine. We can vaccinate the people, and this can go away very quickly before even the third round of this wave arrive. Please do our job, and it's the need of the day. Thank you very much.
Now, call to action, the Reverend Jesse Jackson.
Dying and then here today. Let us pause a moment. Here's in silent meditation to God of your choice. Whether it's Daniel or whether it's either the Bible, let's bow ears in prayer. People in India today, let us pray. Accept our petition, dear God. Bless those who backslide against the wall. Bless these doctors who care so much for their liberation. We're not bring all of us are free. Help us, Lord. Help us. Help us. Have mercy on us. Amen. I'll express my thanks to the opportunity to share today, this occasion. Mr. Mayor, making us feel so welcome today. And CEO Dr. Shields, my God, the best. Express my thanks to those who come in from Chicago today. We had a meeting in Chicago last week with Indians and Pakistanis. The CERN does not know boundaries. You're going to deal with the Indians, you're going to hit Pakistan just and then Europe, and then the rest of the world. If the wild strain came out of South Africa, some project a million may die in India. If that's to be the case, wouldn't have money that will come out of India. We have a need to work with India today. Well, thank President Biden for taking the lead in this, and airplanes and all that. We must raise up this, because the whole world must be a part of this. They were all Indian. We're all one family. And this term unites us in a way nothing else does. As a military leader, we have a challenge for us. It's unusual. Some million people may die, and a million may die. A million. And that is not disease to wipe out the world. It's trans that come out of India. We all have a best interest in there. We have it in India. And maybe we have ourselves. Love relatives, but you cannot help someone without helping yourself. You cannot help without being helped. You cannot hurt without being hurt. So if there's any problem being solved in India today, I'm delighted to be a part of this movement. We have a press conference in Washington this week. We have members of Congress in New York the next week, because we want to rally the world. The headlines are shifting from India to corrupt congressmen and sex trafficking charges. The Israeli-Palestinian conflict in the Middle East. Moving down Indians in the world. We cannot follow the headlines. We must establish rules by which we fight this fight. India must remain primary to all of us. Something I struggled did to India when the humiliation of apartheid came on Mahatma Gandhi in Durban, South Africa. Gandhi would take it. Young lawyer organized a movement in South Africa to go back home to India. Marched to see and drove the British out. I think he drew his inspiration from Jesus Christ and his technology and his methodology from Gandhi. We're all indebted to Gandhi. Indian is part of our family. The Indian doctors and the doctors here around the nation, around the world, it has brought forth a great flowering of health servants around the world. In the Atlanta area, in Greater Chicago, in New York, we need you never before. The reason I support the Rainbow Coalition is that with how big your patch is, it's not big enough. It is the second most populous country in the world, and the biggest democracy in the whole world. Second most populous nation, biggest democracy in the whole world. And when we're in trouble, India's always there with a resource for soldiers. We thank India and feel a sense of obligation. I want us to say here to rally. The people really know what's happening. We need respirators, we need oxygen. We need oxygen, we need respirators.
We need respirators.
We need respirators.
We need respirators.
We need
oxygen.
We need masks. We need human care. Human rights. The one you are sick. Human rights. All human beings. So we're really trying to say today is that we want not so much talking, we need to ask some people to put up money. You don't have a high value says room, I think it's landmarks. I'm mother father said. You have no higher call for your money than to send some money back home today. Your relatives back there. It's a matter of value. It's something American. Our characters on trial. Character made behind the tree. Babies in the how you treat babies and to character. Is measured. How we treat babies. Dawn of life. Poor because of life. Singers. Sunset of their lives. We all have a need to move and move fast. So I want to express my thanks to you for allowing me to share with you today. And we want to mobilize, originally had a lot of hospitals here. Emory and Mercer Hospital, we needed, we had a big stockpile for respirators. And this time of year, we were caught in the throat. We know what it was doing. 250,000 Americans have been killed and never turned the shot before it's over. And it is not over yet, my friends. People are anxious to get the shot again, but the crisis in America is not over.
It's not over.
Crisis in America
It's not over.
Some years ago, when I was a little younger, the Russia had the Chernobyl crisis, the nuclear fallout. I knew when that night, kind of smirked away, said, well, Russia has a problem. They had a nuclear fallout. Russia doesn't have a problem, but the wind blew. Europe has a problem. When kept blowing, and Cal Florida has a problem. So we live in one world community. It affects one of us directly. It affects the rest of us indirectly. We're still one family. If you imagine about what we have, about what we see, what we do. We see the world. We must see the world. We must see the world through a door, not through a keyhole. The end belongs to all of us. And the end belongs to all of us. So I'm here rather than trying to rally troops. Hope that we'll be able to contact hospitals. We also want to contact Hollywood. There's our sending artists in Hollywood. We'll see if Hollywood can do a major telethon, perfect educating and raising resources. We want to have a global telethon, give more resources to India on this crisis. Because, as I said last week, if India is not contained in India, Pakistan is next. Other parts of Asia is next. Poor people in the world will be affected negatively by this thing. So count on us, remember Coalition. Count on us. Thank you very much. President, as well. We'll take President Biden for 7 minutes already. Speak the House, President Senate. Because it's the case that we need to have it. We will know where this thing came from. We will know what it's done. We will do. Africa is as vulnerable as India is. Population is bigger than the health. It says population. And India is bigger than the infrastructure. In Africa, it's bigger than population.
India
is bigger than the infrastructure.
Than the infrastructure.
Africa is bigger than the infrastructure. Among the poor, more poor, are vaccinated. Present to India. Vaccination. Now. Vaccination. Now. Respirators. Now. Oxygen tanks. Now. Money. Now. If you cheer, we'll make some happy.
Now, Mrs. Reena Gupta to give the closing remarks. Reena Gupta is the Director of Public Relations at 27 Investments. She has a deep passion for community work, and together with 27 Investments has been instrumental in raising over $100,000 for aiding COVID relief efforts in India. Reena is a dedicated philanthropist focused on community development and has led several non-profit organizations. She has been awarded numerous accolades for her work. Mrs. Reena Gupta.
Thank you, Dr. Kalai, for your kind words. And thank you, everyone, for showing up at such a short notice, especially President of API, Dr. Sudhakar Chonagada, who drove all the way up here from Bethesda. I am Reena Gupta, the Director of Public Relations at 27 Investments and today's co-host. This is a humanitarian crisis of proportions that we have not seen before. And we are fortunate to have Reverend Jesse Jackson with us to help us impress upon the administration just how important those vaccines are to India. Thank you, Reverend, for your time, your compassion, and most importantly, your words, which I have no doubt will be heard loudly in Washington. Thank you to all the dignitaries to be present here today. Thanks to all organizational leaders who are executing all the projects in the field. A special thank you to Dr. Vijay Prabhakar and Dr. Kalai Chellam for helping us to put the event together from the conceptual standpoint as well as from the logical standpoint. Our own very Mustafa ji, who coordinated everything, even when he was out of town on a vacation. And Anwar ji for the setup. Mr. Shiv Agarwal, as always, for generously letting us use the venue and also helping all the way. Also, 27th Investments for always being in the forefront in helping the community. We would also like to thank and acknowledge Attorney Robert Pichillo of Rainbow Push Coalition, Atlanta, Mr. Parthiban Shankuman of FBT TV, and Mr. Anand Chaturvedi of Eventime. Last but not the least, thanks to all members of media for carrying our message to everyone who needs to hear it. I have no doubt that together we will do everything in our power to contain this threat. Now is the time to rise up in unity, bond together as one, and win this war for the greater good of humanity. Thank you, everyone. Special thanks to Fox, Mr. Len, Anjali TV Asia, Sangeeta Tamil America, Rainbow Push Team, Kiran Manchikanti from UPS. Thank you.
Now, if the panel or the media or the invitees and attendees here, if they have any questions for Reverend Jesse Jackson or the panel, you may go ahead and ask. We will be passing the mic.
Any questions from the media?
Here amongst us, and what do you feel when you see all the Indian Americans joining hands together with you and helping fight COVID? What is your take on the organizations here?
I'm impressed with this group of many people, medical science, medicine, and business in America. All-American Coalition. We got the right vote in 1955, blacks the first time in 100 years. White women got a chance to vote in the South for the first time, races as jurors. 18-year-olds couldn't vote by then because on campuses. A new America was born. So the Indians here were Americans. So all the rights and privileges that any American must have. So we thank you for your contributions. The President of the hate on the cause of the Railroad Coalition.
Thank you. Any other questions for the Reverend Jackson? Yes.
Reverend, on behalf of the Gandhi Foundation USA, where we are housed at the Martin Luther King Center, and on behalf of all the South Asian media, I have a plea to you. We could come together during the civil disobedience and the unrest when India went through the process and the US went through the process. Don't you think we can come together on this immense crisis where it's a death of a similar situation, but going through the virus? Would you take our plea to President Biden and ask all the help that we can with the two largest democracies on the planet?
President Biden and the President Kamala Harris as well, and the Congress, House and Senate, Republican and Democrats. This thing, President Trump, President of England, of London, says none of us safe, all of us are safe. So we should beat the bushes. I'm spending my time right now in Atlanta, Washington next week, Chicago last week, in New York. We must mobilize the world's opinion around this crisis. Headlines shift day to day. It is about the common and the sex trafficking. They say it's about the Palestinian Israelis. Meantime, with the real deaths that are taking place every day, sick people in India have no chance of making it unless we come to the rescue. We must come to the rescue. Our parents may be out to treat Indians at this time like this.
Thank you.
Thank you, friends.
Thank you.
Last question.
Sir, what would you expect from the Indian Americans around the whole of globe, anywhere, to help you to help fight COVID? What is the message you'd like to put across to them?
We need volunteers to represent the Workers' Coalition. With message, many people want to help do something. Some people give money, something to offer the hospitals for American access to respirators. All the hospitals, people died and all they can't breathe. They can't breathe. We must get them the equipment they need. We made it over Baltimore with President Biden. He altered the rules that were to get them out of Baltimore. We should keep working. So there's no stone unturned. And sometimes we say, man, we save ourselves. This ain't running 10 inches. The world will go back to out of challenge. Because I world interest in this situation. So we have an opportunity to serve Christ, give us an opportunity to serve.
Thank you so much.
So please, food is ready. Don't leave without eating. Thank you.